For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning. My name is Michael Lawson. I am the President and CEO of the Los Angeles Urban League. And I want to welcome you this morning to this wonderful occasion. We're at the Baldwin Hills Crenshaw Mall, where we, along with the California Office of Emergency Service, FEMA, the California State Fire Department, and many other organizations, not the least of which is the Brotherhood Crusade, which is our comrade in arms, as far as servicing the community that we're servicing right now. I want to welcome Governor Gavin Newsom, Mayor Eric Garcetti, Secretary Yolanda Richardson, Councilmember Marquise Harris Dawson, and Supervisor Holly Mitchell for this great occasion today. We are here to celebrate the process, the progress that we've made in this community. One of the issues that has been at the forefront of our concern was making sure that our community got vaccinated. And in order to do that, we had to have facilities in our community. Not only did we have to have facilities in our community, we had to have a say. We had to be front and center. And I am proud to say that the staff at the Los Angeles Urban League, the staff at Brotherhood Crusade, and volunteers from the community have stepped up, and we have done tremendous work here. We are vaccinating up to 500 people a day in this facility. And we are getting so many comments from the people that are coming here and saying, thank you for putting this facility in our community. Thank you for leading the charge with this. And I cannot say enough about what the support that we're getting from our state government, the support that we're getting from our county supervisor, the support that we're getting from our city with respect to this and many other aspects of making this work. It looks like it's simple. It looks like it's easy. It is not. And I want to say a shout out to the volunteers from the Urban League who have been here from day one. We got the call, we sat down and talked about the possibility of doing this, and within 36 hours it was in place. I have to give a shout out to Bonnie Jeter Thomas, who has been a leader in this, and to Maisha Kiff, who has been working day and night trying to make sure that everybody gets what they need. But you're not here to listen to me. There are too many very important and just essential people who have come down to see this facility. You saw the governor getting his vaccination. We are so proud of the fact that he took the time to do this here in our community, because it's important that he see our community. And I can't say enough about the other electeds that I mentioned. And without further ado, let me introduce the next speaker, the mayor of this great city, Mayor Eric Garcetti.
Thank you so much, Commissioner, Ambassador, and Angel in the City of Angels, Michael Lawson. We really appreciate you, appreciate Sharice and the Brotherhood Crusade, and Alberto, and Community Coalition, Cookie, all the friends that are here that for so long have been doing the work to, together with this great governor who doesn't need to see the community because he's always in this community. And I want to thank him because this community loves him, and I know how much he loves this community. And I want to thank all the hard-working volunteers and staff that are here from our community groups as well as from the state who are just doing an extraordinary job making this one of the happiest places on earth. Vacciland, we call each one of these places, because you see and feel that joy that, Governor, I hope you felt. It happens in a split second, it doesn't hurt, and yet it transforms everything. It's like the cloak of, protection around you. The melting away of a year of suffering and trauma and pain begins to finally go away. And I know this has been the toughest year in our history, as a city, certainly, and county, as a state, a nation, arguably as a world. But as a result of this governor's leadership, of the 8 most populous states in America, we have the lowest deaths per capita anywhere in America. I want that to sink in, because I was once told by my friend, mentor, Mike Bloomberg, he said, the things that people look back on and are most glad that I did were the ones that made me the least popular in the short term. That's what leadership is about. It's not about trying to get short-term praise or being worried about the headlines tomorrow or the folks that are upset today. It's looking back 10 years from now and saying, what did I do to save lives and to do right? We're now looking at a moment in which things are opening up again. In fact, it's almost surreal. I went to a mall for the first time 2 days ago to fix my wife's iPhone, because I'm tech support in the house. It was amazing to see people out eating, to see people feeling what makes this city and this state great, provide families and businesses the relief that they need now. But thanks to the bold leadership of this governor, the tireless effort of this county, who we've never worked more closely or more harmoniously together, and I want to thank Holly Mitchell for her extraordinary leadership. A city council led by one of the great leaders on the city council in this district, Marquise Harris Dawson, who have said we will roll up our sleeves and make sure not only we roll out this vaccine, but we roll it out equitably. Los Angeles is the only large metropolitan area in this country, I believe, in which African-American deaths, which used to be across the country double the represented population, take away that first month, and after we jumped into action, African-American deaths are less than the represented population because of the testing, the education, the surge. And now we see vaccine hesitancy coming down too, because people realize this is killing us. We need to protect ourselves. And today we have a 1.4% positivity rate, the lowest we have had since April of 2020, the lowest we have had since April of 2020. So, Governor, you've come to the right place to get your vaccine. Here in Los Angeles, we've shown that when doses arrive, we get them into arms. Each week, more than 90% of them out the door. The City of LA, in partnership with the county, our city-run sites, have had more than 750,000 doses of life-saving vaccines. And we know that being Black or Latinx, Pacific Islander, Native American, coming from a lower income zip code, living in a multi-generational household, these mean that you're more likely to get COVID-19 and unfortunately to die. So we haven't shied away from that hard truth. And we've been doing mobile clinics delivering over 50,000 doses, over 90% for residents of color. And last week we announced a new mobile clinic partnership in Watts that will deliver 5,000 shots a day in Watts. It's that record of speed, of safety, of efficiency, and equity that led us, and I'm proud to be able to co-announce with the governor today, that we were able to say yes when Governor Newsom asked us to take over operations at the Cal State LA mass vaccination site in East LA. The result of this governor's advocacy in Washington, one of 2 of the first in the country, both in this state, in Oakland and here. So we will take over those operations as a city. We couldn't be more proud or more ready to get the job done. Together with the county, we'll get the doses. Launched by FEMA and Cal OES as a pilot site, it will have administered 300,000 doses in just 8 weeks. And now as they prepare to hand the keys over to us, we're getting ready to seize this opportunity to integrate the site into our larger citywide efforts and to get more vaccines into arms. We can do so much more. And I still continue to ask the federal government, give us those direct doses to the county and to the city. We'll get the job done. But I'm thrilled the governor is here to model what leadership looks like. I've seen that privately behind the scenes. I see it publicly alongside you, and there is no more task that is urgent. You know, the years tell us things that the days cannot see. And 1 year into this, we can begin to feel and understand what California leadership did to not only position this state for a rebound, but to save lives of people we will never be able to count. We can only tragically count those who are lost. But there are many people in this city alive because of you, Governor, and I thank you. briefly in Spanish, and my apologies, since there's another press conference at City Hall, I'll miss your talking points, but I'll get them on the news, Governor. Hoy es un gran día para California. Empezamos un nuevo capítulo en proteger nuestro pueblo del virus. Y es un hito en la recuperación económica de nuestro estado también. Hoy, gracias al gran liderazgo de este gobernador Newsom, y esfuerzo incansable de él, cada californiano con 50 años de edad o más es elegible para recibir la vacuna COVID. Gracias, gobernador. En Los Ángeles sabemos cómo vacunar a nuestra comunidad. Hemos demostrado que cuando las dosis llegan a nuestra ciudad, los administramos de manera rápida, equitativa y segura. Mientras protegemos a nuestra ciudad, no dejamos a nadie atrás. Nuestras clínicas móviles han administrado a casi 50,000 vacunas en las áreas más afectadas de Los Ángeles. Y por lo menos en 90% se han administrado a personas de color. Este récord de velocidad y seguridad, tanto como de equidad y eficiencia, nos preparó para aceptar la solicitud del gobernador Newsom para asumir las operaciones en el sitio de vacunación de Cal State LA, en el este de Los Ángeles. Sin embargo, este no es un esfuerzo individual. Contamos con nuestros socios federales y estatales para colaborar con nosotros, apoyar este sitio con más dosis y asegurar que tengamos el suministro de vacunas que necesitamos para cumplir. Hay personas que están viviendo como el resultado del liderazgo del gobernador Newsom. Yo quiero dar las gracias de nuestra ciudad y condado, y todos podemos participar en esta visión. Vacunate ya para que podamos avanzar en nuestro esfuerzo para acabar con la pandemia y para poder reunirnos otra vez. Gracias, Gobernador Newsom. And with that, let me introduce my dear friend, a state leader who I'm sure the governor misses as the budget chair, but she's doing an amazing job as the supervisor of this great county, the one and only Holly Mitchell.
When the mayor said he knows the governor misses me, I turned to look at the governor, and I didn't get the sense that he really misses me, but you know. Welcome, as I always tell you, affectionately to my hood. And I say that with great respect and affection for the Leimert Park Crenshaw community. You know, hood is an abbreviation for neighborhood, and this is a neighborhood rich in history and culture and diversity. You know, I'm a native of Leimert Park. I've welcomed you here a couple of times, and we've had breakfast at CJ's and bought books at Esselwan and went to Hot and Cool Cafe. And now you're here at the historic Baldwin Hills Crenshaw Mall, which was the first contiguous shopping mall built in the country. A real visionary that the Leimert developers had many, many years ago. So I welcome you to the Baldwin Crenshaw Mall. It's a pleasure to have you here. I want to congratulate Secretary Richardson. Secretary, like me, you got blaccinated. Black women who got vaccinated, we got blaccinated. And it's important that we talk about that, because the reason why it's so valuable to have the vaccination site here, for the governor and the secretary to come here, is for us to talk about communities of color who've been disproportionately impacted by this virus, this dual pandemic, this public health pandemic and this economic pandemic. And you can see it along the Crenshaw corridor. We've got small businesses who are suffering as a result of this pandemic. So we are honored that you were here and that you chose to be vaccinated here in the Crenshaw community. For me, it's times like this that government is made for, and to see collaborations and partnerships. Just yesterday, I was at another vaccination site with Weingart Foundation, St. John's Family Child and Well Center, and SCIU 2015, where philanthropy, labor, and a FQHC came together to set up a clinic. Here today, FEMA, federal government, Cal OES, the state level, as well as our nonprofit, our rich nonprofit institutions in this community, the Urban League. I saw Mothers in Action here, and of course, Brotherhood Crusade. organizations who have a commitment, a longstanding commitment to the people who call this community home. Organizations who, when they call and say, hey, we've got a vaccine site at Sears, come on down, it speaks volumes, Governor, because the community knows that those organizations have their best interests at heart and they show up. That's why these partnerships have been so successful. That's why we've been able to increase significantly the numbers of Black and Latinx community residents who've been able to get through and navigate their way through the process to be vaccinated. And that's why these community partnerships will and must continue. And I'm proud to know that they will. I've been saying to the governor and his people for the last maybe 2 months, hashtag where the vaccine at. And so, and to my utter dismay, it didn't catch on. But we know where the vaccine is right here, right today. It's in the Crenshaw Baldwin Hills Mall, and some of it is in the arm of the governor and the secretary, and we're proud of that. It gives me great pride to welcome you all and to introduce the 40th governor of the great state of California, Governor Gavin Newsom.
I do miss our former budget chair in the Senate. What a remarkable leader here, and what an extraordinary opportunity for people down here in Southern California, particularly in LA, to have her leadership as county supervisor and incredible partnerships and her ability to navigate all things Sacramento to get the kind of support the community deserves. I also want to just thank, in absentia, the mayor just left, because I wanted to brag on the mayor. I'll try to integrate that into my remarks here in a moment because of his incredible partnership. And by the way, I just think it's notable, in not every state can the governor lay claim to those partnerships at the local level. We are blessed to have extraordinary leaders at the county and city levels, the vast majority of them that have been hand in glove working with the state of California, not as sparring partners, but as working partners, not with a closed fist, with an open hand, humbled by this entire experience, as the mayor rightfully referenced this last year, this journey that we've all been on together, now seeing that bright light, not just light, bright light at the end of the tunnel. But it's been an extraordinarily challenging year. So much fear, so much anxiety, but now growing optimism about our fate and future, not only here in Los Angeles and Southern California, but all across our state, and increasing case rates increase over the last 2 weeks. In many other states, we've seen these mutations, and we are tracking 7 mutations, 7 variants here in the state of California. These variants having an impact on transmission in states large and small. We've had the opportunity and incredible dialogue with governors all across this country, Governor Whitmer in Michigan battling these variants, and Governor DeSantis in Florida battling these variants. We need to be mindful that now is not the time to spike the ball. Now is not the time to announce mission accomplished. We have enormous opportunity in the next 6 to 8 weeks to run the 100-yard dash, not the 90-yard dash. Let us not dream of regretting. We've come so far together, and we're this close. 18+ million vaccine doses have been administered in the state of California. Only 6 other nations in the world can lay claim to that many doses being administered to their population. 6.6 million more doses of vaccine have been administered in the state of California than any other state in the nation. We're also mindful, and the reason we're here, that it's not just that top line number. The number that really matters is that equity commitment. It's one thing to talk about in rhetorical terms. It's another to deliver on it by delivering in community, in language, in a culturally competent way, bottom up. And we in the state of California have committed to what no other state in the country had. 40% of all our doses over the course of the last few weeks, 40% overlaid with an equity frame, an equity index that we're utilizing, census track, neighborhood by neighborhood, zip code by zip code, making a determination that we need to do more and do better. And by the way, I'll say that still. We need to do more and we need to do better to advance the cause of equity. It continues to be stubborn. And so indeed it is, Supervisor, a reason I am here and honored to be here in the community. Michael, thank you for incredible partnerships that you've established here, proving the paradigm. This can be done if we commit ourselves to it. We can actually deliver on that promotion, on that promise, but we have to build more partnership. We have to build a sense of community. And at the end of the day, trusted messengers, with all due respect, they're not in Washington, D.C., and they're not in Sacramento. They're in the community. I was just sitting down that 15 minutes after getting my vaccine, talking to members of the community, and they're the real ambassadors, the people that were sitting next to me after getting their doses, to go back in their community, go back home, talk to friends and family, and say, I just got my vaccine, you should do the same thing. And so that's the power. It's the power of emulation, the power of example. And that's the power we want to promote here today, because 18 million is not getting us to wherever that herd immunity number is. Is it 31 million? Is it 32? How do you define herd immunity? 75%, 80, 85%? How do you define it in a world where there still is resistance, where there are variations, mutations, in a world where not all our children are even eligible to receive the vaccine? So we still have more work to do. But 18 now million vaccines have been administered in the state, 3.5 million under this new equity index. We now have over 31%, or just shy of 31% of the state now fully vaccinated, or rather, excuse me, having received at least one dose of vaccine. We're now getting the J&J vaccine in numbers we haven't seen in the past, 572,700, 572,700 we just ordered, arriving next week, single dose, one, as they say out there as we're waiting, one and done. We're also seeing an increase in supply across the board of Pfizer and Moderna, 2.4 million we anticipate receiving next week. Put that in perspective, 2 weeks ago it was 1.8 million. 2.4 million we anticipate receiving next week. That's why today we're allowing everybody 50 and over to have access to the vaccine. Starting today, anyone 50 and over in the state of California is eligible to receive and administer a dose of vaccine. We have 2 weeks where everybody 16 and over in the state of California, regardless of pre-existing condition, ability to pay, regardless of immigration status, is eligible to receive their vaccine. And we're confident we can deliver on that as long as the manufactured supply still comes into the state of California. That's the one criteria, that's the one condition, and that's what we're mindful always of. There's fits and starts, there's iterations. You saw that highlighted by J&J issues, some manufacturing issues that are not impacting our 572,000 order or the 215,000 that we anticipate the week later. But we're mindful of those considerations as it relates to our ability to actually deliver on what we all are promoting, not just here in the state, but as the president's been promoting that 200 million figure that he has announced as his nationwide goal. I want to just say a couple things about the FEMA site, and I appreciate the mayor's leadership. The mayor has taken the baton without hesitation to have a seamless transition from the Cal State LA site and to now take over that effort at a local level. That includes, by the way, these mobile sites, the site that we are in today. This is currently being operated in partnership with FEMA and with Cal OES. By April 12th, we will transition the site at Cal State LA and the mobile sites like this to the city of Los Angeles. We're working with the Biden administration to talk about allocations because, as you know, the current doses do not come out of state supply, but let's put it in perspective. California has administered over 18 million doses. The two FEMA sites combined are less than 4% of our entire delivery system. So it's not profound in terms of its impact, but it is an impact nonetheless, and we try to get every dose we possibly can. We're working accordingly up in Northern California at the Alameda site to transfer as well, likely not to the city of Oakland, likely to the county of Alameda, and they will have a more distinctive and unique operation than the current one because of some of the logistics concerns as baseball season reopens. That's at the site of the Oakland A's, and so there's some criteria and considerations that need to be addressed as it relates to logistics up there. More to be said on that later. So just honored to be here. Happy to take any questions. I want to just acknowledge the incredible leadership of Dr. Ghaly throughout this entire process. Yolanda Richardson, who's our vaccine czar. She hates that phrase and term, forgive me. But she's been running our vaccine efforts. It was wonderful to have her here as well. She waited her turn, as we did, as I did as well. And I just encourage everyone 50 and over, do what I just did. And I would encourage you, when you're curious, what's the best vaccine to take? The best vaccine is the next one available. With that, happy to take any questions.
Got some questions out over here.
Hi, Governor. Colleen Shelby with the LA Times. Thanks for taking questions. I wanted to know what you would say to those who are newly eligible but may have to wait a bit longer for their appointment just due to supply or tech or mobility limitations. And I'm also wondering if you can tell us if your wife, the first partner of California, is planning to get her vaccine.
Yeah, she is, as she reminded me today, she's not 50 and happy about that. So she's still waiting her turn. So she'll get it when her eligibility comes up, which I anticipate in 2 weeks on April 15th. But look, let's be mindful. Just because you allow the access doesn't mean everybody can rush and get a reservation, can get scheduled to get the administration of the doses. And remember, our biggest constraint continues to be manufactured supply. Let me put in perspective, that 2.4 million that we're getting next week, we administered over 2.5 million last week. So constraint, again, is manufactured supply. We've designed a system through this TPA, of which now we have 81% of the population in the state of California with memorandums of understanding as part of our third-party agreement with the state and with our third-party partner. We have the capacity to do 5 million doses a week. That's the system we've designed. Again, just 2.4 million coming next week. So it's going to take a number of months for us to exhaust that demand. So even though we're lifting the eligibility, bringing down the age to 50, 2 weeks to everybody 16 and over, that doesn't mean April 16th, everybody that wants a vaccine will have been vaccinated. It still will take a number of months to get to that point.
Excuse me.
Governor Mike Blood with AP. I was wondering, along those lines, you mentioned a couple of months perhaps to exhaust the demands. Do you have any more precise sense of that? And part of the reason I ask is I did a random scan of the county website today looking for appointments. I probably went to about 24 different websites for Walgreens and other places. They're all booked for the next week, no appointments for 7 days. So I'm just wondering, this big new group coming in today, more coming in a couple of weeks. How long will that process take till everybody can actually get in?
It is completely determined on the basis of manufactured supply. It's what we have available. And by the way, and it's a sophisticated question in this context, the supply is threefold. You have supply coming into the state. That's the 2.4 million. You have supply going directly to the pharmacies. And you may have seen this last week, Walmart, Costco, and others now are part of the pharmacy direct allocation from the federal supply to the pharmaceutical, or rather to the pharmacies directly. And the third is the direct allocations going to community-based health clinics, FQHCs. And those supplies are increasing as well. So in total, as we see more supply be made available, hopefully we'll see some loosening in terms of those constraints, in terms of the schedules as it relates to the number of people that are able to access and reserve a time slot. That said, again, our estimates, and I see, Yolanda, you're here, and I might as well take advantage. I love that you're on the road with us. You know, when we say the next couple months, I mean, you have any greater insight, or is it, I mean, it's illusory on the basis of what actually comes in?
It's absolutely, to your point, Governor, it's definitely.
Yeah, take advantage of being here.
Thank you. as the governor said, it's definitely based on the manufacturing supply. I think all of us are anxiously following the news and watching the federal government and also watching some of the new products that might be available. But the governor does a great week every week of telling what's coming next. And as we have those doses available, we're getting those to sites such as this and sites across the state to make sure that whatever we have, those appointments are available, and we'll continue to do so as hopefully the supply increases over the next month.
To clarify that question, so those are the reasons why you can't say why it might take 2 months, 4 months, 6 months. There's too many pieces moving, as the governor pointed out.
That's correct.
But there's no indication it will take 6 months.
Yes, yes.
I want to level set on that. I mean, we're looking, look, we're at 18 million. We were 17 million just a few days ago. I mean, you start doing the math here, and then you start getting to the point where there are going to be people that are just naturally resistant, and there are all those people 16 and younger. Now, that will change as well. And you saw, obviously, the authorization that is likely in a few weeks for people 12 and over, at least for one of the vaccines. Pfizer, Moderna is also in their study, and we're hoping to see that number even drop lower. They're doing studies on 11-year-olds, and we hope to get it down to 6 months and over. And that will then expand the universe of availability, but in terms of the universe of those that are eligible. That said, we'll be at 20 million next week. You start getting to a point, even with the constraints, it shouldn't be more than a few months.
Thank you. I just wanted to add one point, because you talked about having gone to the county website this morning to navigate. What you should be confident knowing that as supply increases, we have the infrastructure here in LA County to administer it. So we have, between our hundreds of community-based partners and the mobile sites and the pop-up sites and sites like this, we have the infrastructure to make sure that once we know the supply of vaccine, we have the capacity to add to those appointments and get shots in the arm. So we're not waiting to set up the infrastructure. The infrastructure exists, and that I'm very proud of.
Hello, I'm Anna Almendrala, Kaiser Health News. Governor Newsom, if you lived in another state, you might have been eligible for the shot months ago. What data or signs or signals are you and Dr. Ghaly looking for to know whether California's decision to have special eligibility tiers and to hold the general population back for as long as today will have been worth it in the end?
Well, it's our commitment to equity. It's our commitment to vaccinating the most vulnerable. Remember, 75% of the people that have died from this disease, and this disease continues to be deadly. Close to 150 people lost their lives, families torn apart because of the deadliness of this disease. The disease is not taking Easter weekend off. This disease is not taking spring break off. This disease remains as deadly as it's ever been. The only construct that's changed, the reason we're at 1.9% positivity, and over the last couple weeks, we've had among the lowest positivity rates in America, is because of the vaccine efforts and because of the natural antibodies for those that have been exposed, and the good work that many of you do every single day in terms of the non-pharmaceutical interventions by practicing what we're preaching, particularly in terms of mask wearing, which is foundational. Many other states have lifted the mask mandate, and you're seeing their numbers reflect that. You're seeing numbers increase in other states. In California, we've been able to hold pretty steadily for the last few weeks, mindful that we have 854 UK variants that we have sequenced in this state, mindful that we now have 35 Brazilian variants that we have sequenced in this state, mindful that we have 10 South African variants we've sequenced in this state, mindful that we have close to 9,300 West Coast variants that we have sequenced. We need to be cautious, and in that respect, we've prioritized the most vulnerable. We've been deliberative in terms of age-based and exposure-based, looking at occupation. I was just in the Central Valley yesterday with the First Lady, celebrating Cesar Chavez Day at 40 Acres, original headquarters of UFW, committing to the cause of equity that includes doing what many other states have not done, and that's prioritizing their farm workers. This is a specific answer to your question. This is what we do. Not every state does that. And to me, that's who we are. And those are values I hold dear. And so our commitment to 40% of the distribution going under a Healthy Place Index quartile 1 frame is, trust me, not something those other states are doing, that we believe in. And so those are the criteria we used. And today we're pleased. Not every state is where we are in terms of age eligibility, even at 50, but that we are here today because of the good work Holly and her team have done, and so many other members and partners from the Urban League and all the other CBOs, 337 strong across this state that are truly delivering. The state vision is realized at the local level. And so I applaud all our local partners.
Governor, Margaret Carrero from KNX, thank you for taking questions. A couple things. The president, CDC, warning too soon for the loosening of restrictions and so on and so forth. And like you had mentioned, we're seeing the variants, we're seeing the cases go up in other states. Yet we are opening up. Do you feel that this is the right move for California? That's number one. Second, are you concerned about a spring surge? And third, how does California benefit from the infrastructure plan that the president has come forth with?
Don't get me started on the infrastructure plan. I couldn't be more enthusiastic. That said, let me get to the more sober part of your questions. Look, yeah, we're very mindful. We're very concerned about these mutations. I wake up every single morning. The first number I see is case rates, 2,234 today. I look at positivity, 1.9%. I look at deaths, 154. And then I immediately go to where we are in terms of the sequencing, the genomic sequencing that we're doing at a scale no other state in America is doing. And that's why I was able to point to the 800 plus now, the UK variants, and this West Coast variant. There's 2 West Coast variants that we've been tracking. And we're very mindful of that, and we've been very sobered by these mutations, and we all should be very mindful of the impact they're having, particularly in those 2 states that have this most significant number of the UK variants, and that's Florida and Michigan. And so we are cautious and we are concerned. That said, we're still in this tiering frame. And so data and transmission rates are making the determination of how we move. Mindful that if we see numbers increase, the blueprint, which is now 30 weeks old, allows for us to toggle back. It's a dimmer switch, on and off, up, down. And so we have the capacity, not on whim, not on political considerations, but on the basis of serosurveillance, transmission rates, case positivity rates, broadly defined with an equity component to be able to move in whatever direction is necessary to focus and resolve to finish this entire process with a health frame first. As it relates to the infrastructure plan, it's a game changer. It's a once, I didn't think I'd live to see something that my grandparents talked about. It's an extraordinary moment in American history. If they can pull this off, generations of Americans will be the beneficiaries of research and development, of increased supply chain, increased manufacturing, increased competitiveness. When you have a president of the United States talking about the care economy in the context of infrastructure and seniors, that's an enlightened leader. I didn't think I'd hear those things from a president. And so I couldn't be more proud. I was telling the First Lady yesterday, for California, it completely matches our values and the progress we're making as a state. This state's running close to a $25 billion operating surplus, and we're the beneficiary of an equivalent amount coming from the federal stimulus. In so much of the investments that we will preview in our May revise are consistent with the investments the Biden administration has advanced as it relates to this $2.2 trillion bill. So we are very, very enthusiastic about what it means for all of us here in the state of California.
Governor Alex Nieves with Politico. What effect does the 15 million ruined J&J doses and potential future delays as the FDA investigates the error have on the state as it opens up eligibility, given that the plans have been contingent on increased J&J supply?
No, that's right. And so before I answer that, it's also contingent on increase of Pfizer and Moderna supply, which has not been impacted. So we are anticipating an increase in supply on those 2 dose regimen, regardless of what seems to have occurred in Baltimore at the manufacturing facility. The J&J vaccine dose that I just received comes from Netherlands. It's independent of that supply. It's a direct allocation coming from FEMA. It's independent of our own state supply. Here's what we know. Here's what we've been told. That our 3-week window on J&J has not been impacted by this manufacturing issue in Baltimore, which means, let me be specific, that we anticipate receiving 572,700 doses next week of J&J, 215,400 doses the week later, and 215,400 doses the week after that. That's the window to which they have given us confidence to say is secured. Beyond that, it's an open-ended question.
Thank you, everybody.
Thank you all very, very much.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.